8:06. Good morning. My name is Atiemie Andrew. Well, I'm sure you're aware of the news making the rounds already. The names of local government administrators and all of those have been circulating with the document online and different reactions. But that would not be the focus of our conversation already. Today, we are looking at the health sector. And the reason so is because since this declaration of state of emergency for many in the various sectors, we know boards have been dissolved and several areas and sectors of the economy of the state has been affected one way or the other. What is the situation like in the health sector, especially the primary healthcare sector of Rivers State? This morning, I would be speaking with the National President, Primary Healthcare Workers Association of Nigeria, Mr. Daniel Atiemie. Sir, good morning to you.
Thank you, listeners.
And would like to understand what impact the emergency rule is having in the primary healthcare sector in Rivers State. Now, if you have, since the emergency rule, experienced changes in the delivery of primary healthcare, let us know the experiences you've had, and you can do that by getting on Facebook at Nigeria Info 92.3 PH and dropping your comments for us, or using the WhatsApp number 0809-030-6416. I will now go to Mr. Daniel. Again, thank you for joining us, Mr. Daniel. So how has it been thus far? The last time we spoke, we were discussing workers' welfare and work of the government, led by the governor at the time, and the efforts they were putting in improving the healthcare sector and building of primary healthcare centers and regional hospitals and the rest of them. What is the situation now since the emergency rule in the healthcare sector?
Ms. Atiemie, I will say the truth. The situation has not improved. And in particularly, I want to talk on two areas: the functionality of the system and then the effect on the personnel, that is the welfare of primary healthcare workers. So on the area of functioning of the system, you will agree with me that state of emergency did not contemplate some of the things that may be happening as a result of the state of emergency, such as funding of the system to function very well. You know, some of the agencies in Rivers State has been dissolved as a result of the state of emergency. So the system is somehow suffering as a result of the state of emergency. Though I will not really delve in detail about the state of emergency, because as a civil servant, we find ourselves in a state of emergency, and most people in the public, some are against the emergency rule and the suspension of the elected officials of Rivers State. Some are in support. So at the appropriate time, things will resolve themselves at that angle. So I will not delve into that. But like you rightly said or mentioned, what I am here to speak is how the emergency rule is affecting primary healthcare service delivery in Rivers State vis-a-vis the functionality and the personnel, their welfare.
You mentioned funding. So you're saying since the emergency and the boards were dissolved, there's not been funding to help your work, improve your work?
Of course, it is in the public domain that as soon as the emergency rule came and it was applied to dissolution of or suspension of all agency, like the Primary Healthcare Management Board is an MDA agency of Rivers State government. So the account of the Primary Healthcare Management Board was consequently frozen. So when it comes to funding, there is no way the system, those immunization programs can be funded again. So except the sole administrator look into that matter. Then on the second area is the primary healthcare workers. Before the suspended governor left, he has already approved minimum wage, 85,000 naira minimum wage for primary healthcare workers of Rivers State and as a whole local government. Then specifically the consolidated health workers salary structure was transmitted to the various local government for implementation. But as the emergency rule came, some of the head of local government have used that as an opportunity and they refuse to implement the consolidated salary structure, that is CONHES, for primary healthcare workers. So this is also a very serious area the emergency rule is affecting.
All right.
Primary healthcare.
We'll take a commercial
service.
shortly. When we come back, we'll shed more light on some of the things you raised. You talked about one of the programs, the immunization program now would be hindered except funds are released.
Exactly.
We'll also try to find out which other programs perhaps is being affected because of the paucity of funds, and whether or not there's been efforts to get in touch with the SODA administrator on behalf of workers. All of that and more when we come back after the break.
You are tuned.
Seven minutes past 8. The conversation continues. I have Daniel Atiemie with me, National President, Primary Healthcare Workers Association of Nigeria. My name is Atiemie Andrew. He said a few things. The first half of our conversation, how the state of emergency is affecting the health sector, especially primary healthcare delivery, and he'll be highlighting some of the programs that are affected and how this is also affecting workers at that level. And then I've asked you to let us know what experiences you've had since the state of emergency. If you have tried to get healthcare service at the primary level, what is the experience been like? Let us know, because now there are people that have raised concerns about, well, you go, they tell you no drugs, they have no board, there's not released money, we don't have this, we don't have that, and all of those complaints have been coming. So yes, get to us on Facebook at Nigeria Info 92.3 PH. Don't forget to also use the WhatsApp number 0809-030-6416. All right, Mr. Atiemie, let's get back to you. So you were saying that immunization program is one that has been affected. How much of an impact, what level of impact is the emergency rule having on that? And how do you usually get the funds to run that program?
Yes, during immunization, it will be planned, and then subvention will be made, especially by the River State Primary Health Care Management Board. And
that has been dissolved now.
Yes, okay. And it is state government that give the fund to the Primary Health Care Management Board, and in alliance with local government. So now the board has been dissolved. The appointees, the political appointees of the board, that is the people functioning at the apex of the highest echelon of the board, has been dissolved. So the account is also consequently frozen. It means there will be no fund to use and fund run the program. Immunization program is very capitally intensive, because a lot of supplies and other things will be mobilized to ensure that it gets to the grassroots, where the target audience or beneficiaries of this immunization are there. So at the community or rural level, health workers get there and immunize our children.
So at the moment, children are not getting immunization.
They can't get it. There is no two ways about it, except special intervention. The sole administrator goes into it and then intervene in the system by providing or looking for a way that funds will be provided to run the program.
So what other programs besides the immunization?
Beside the immunization in the healthcare system, when you walk into health center, there are other services you get free of charge, because the River State government and the local government are paying them through the board. So those services are rendered pro bono or free of charge. No. But once this emergency rule set in and the system has been suspended, of course you don't need
if you can be more specific, what are some of those services that are pro bono or free of charge? What are some of those?
For example, this family planning, child nutrition. Recently, the board flagged off child nutrition from one community to another, and they were giving the proper or best nutrient that a child is supposed to take and grow very well intellectually, physically, and otherwise. So these are services that are presently affected by the emergency rule we all find ourselves in.
What about medical supplies? How are hospitals at the local level running out? Are they running out of? Or what's the situation with that? Because for the work to be done, let's have this conversation so we understand what the implication is. So
the medical supplies, those that work in the lab, they need laboratory reagents. These are like the Izal, those chemicals and some other supplies they need in diagnosing, making sure that proper diagnosis is done for our people. these supplies has been cut off.
How do they usually get it? The board was providing funds?
Yes, the board usually provide and then distribute according to the local government, to all the local government area. That is why in the board they have the drugstore, the cold chain where vaccines are kept, and these vaccines, most of them are procured. They are bought with money, funds.
And those monies are provided for by the state government?
Yes.
So what's the state with the vaccines now? Are we getting new ones? Is there any of such?
There is no fund. There are no funds to procure those necessary medical supplies at the moment. So in other words, what I'm saying is that the whole system has been affected by the emergency rule, and I'm calling on the sole administrator. He should intervene quickly so that Rivers people will enjoy in this care service delivery that we used to enjoy.
So what happened with workers? Because I know that there were issues with employment posting before, and then salaries and so on and so forth. So now you've talked about how the delivery of health care is a problem because of the situation. Has this emergency rule also affected the workers' salary posting and their approach to work?
Mr. Atiemie, it will surprise you to note that most times what people stay aside and talk, and if you give them the opportunity, like when the suspended Rivers State governor was in office, as soon as the local government chairman were vacated by the Court of Law, Supreme Court, he invited all the principal officers of local government, namely the HLG, Head of Local Government Administration, the HPM, and the treasurers, and then handed over to them the salary structures for payment of local government workers, and as well as primary healthcare workers. You know what makes primary healthcare workers distinct is that we as health professionals, we work in a hazardous environment.
Yeah.
If you are not careful, you contract what is called nosocomial infections. Those are infections that you get from a hospital related environment and some other hazards. So government deem it necessary to provide the payment of hazard, what is called inducement, to induce you to be able to go and work in those type of environment. We also run a shift and some other allowances that are related just particularly to health. Now the question is that even if we are working in local government, are we not health workers that we shouldn't benefit what is due health workers? But these HLG blatantly refuse to implement the salary structure that was handed over to them by the suspended governor of Rivers State. Assuming the governor did not leave and he is there, he would have maybe forced them or compelled them by authority of government to implement whatever he has approved for primary healthcare workers. But since he left, they now came under the cover of emergency rule and refuse or renege from doing what they are supposed to do. And ordinarily they are civil servants, but what they have demonstrated that most of them are politicians.
Okay, I need to understand this. So from what you just said, it's quite shocking, I must say. But the point is, what the implementations and the salaries and allowances, these things are legal rights of workers.
Exactly. They are legal.
Because we need to be clear. Did they give a reason why they felt they were not going to?
Exactly. They are legal right of workers. You know, salary structures are applicable to some agencies. When a minimum wage comes, they will compute, and then the River State government, the document I have was the one this former head of service, George Weke, signed and transmitted to all the agencies. It got to Local Government Service Commission. Governor got that document and he handed over to them. It is our legal right. It is embedded in what is called the Consolidated Health Workers Salary Structure. Then the one that they use in paying medical doctors, short form is CONMES, Consolidated Medical Practitioners Salary Structure. So all the agencies and parastatals, they have peculiar, like teachers is contis. One, they pay teachers. So I see no reason. I don't know. I'm even surprised why these people are so wicked and have decided to oppress a group or class of people that are rendering an essential services to help the people of River State. Let the general public also know that should anything happen and we decide to withdraw our services, it is caused by these HLGAs that are bent on ruining the good intention of government. The suspended governor have done his part. So I'm also using this medium to inform the sole administrator. Let him not hobnob or romance with these people that do not have goodwill for River State.
Right. That will bring me. This question wasn't part of the conversation, but because we're talking of the HLGs and you're saying that the meetings they held and the documents that were given to them and things they were supposed to implement, they did not. And now you said they are hiding under the guise of self-emergency rule. The sole administrator has decided to appoint sole administrators for local government areas. Do you think that even though some people think that, well, that's not within his purview, it's unconstitutional, it doesn't follow the laws and so on and so forth, do you think that that would bring some form of succor and maybe change the situation with regards to some of these implementations?
As a very senior civil servant, I think that the duties that will be assigned to sole administrator at any level, there will be limitations. There will be limitation. They may not be able to explore fully the duties of a proper government. So, so far, I will put it this way, let us see what will come forth. I will not really say they will be going there to do well. But our call, and we are calling seriously. It is our voice is very loud on this, that whatever the reason, the sole administrator, the state sole administrator should take note of this so that he can also direct the administrators at the local government on these issues.
But they are going to still have to work with these HLGs that you say have been adamant with regards to implementing that salary structure and payment of some other benefits that they should be paying workers, which then brings me to now the morale of workers. Are workers still going to work at the primary healthcare level? Yes,
primary healthcare workers were still going.
And you got your salary for the past couple of months?
We're still going to work. We've gotten salary. They've paid salaries for February. Some LGs, LGs have paid for March. Down one now will bring another question.
Because
why has some not paid?
So
when the monies have been released,
this salary structure was used to pay. Was it on the new minimum wage?
They paid the 85,000 naira minimum wage
for some of those ones that
yes, it was haphazardly implemented. You know, that 85,000 naira minimum wage was broken down to the conheads, to compass, which the general council workers, the traditional council workers, normally take or benefit. So they selectively, partially implemented the minimum wage to our great detriment. So far, some LGAs have paid for 2 months, February and March
Do you have
salaries.
idea of any of them?
But
Any of the LGAs that have paid for 2 months, you can mention any
yes,
of them?
Abua Odwell have paid. Falga, Port Harcourt City local government.
That was under the HLGAs?
Yes.
Okay.
Have paid. And some other ones. There are ones that have not paid till today as we speak. They have not paid. Why have they not paid these salaries to the owners? Are they investing the money to make profit? These are some of the issues we are talking about. You are giving a role as a HLG. In fact, the next line of action we'll take is serious protest against these HLGs if they don't change.
Okay. We hope that would work out well, because the last protest that we just had wasn't too fantastic.
We are workers, and protest is within our right or any other industrial action.
All right. You heard the national president, primary healthcare workers. Now, let's quickly look at some of your messages. Take some calls now as well. The number to call is 0817-923-0007. You can also call 0817-923-0002. A few things he said, I think you can take away from this is some of the programs that have been affected as a result of the emergency rule, funding of some of the health facilities at the local government level now becoming a problem. Sponsoring of some of the programs is now a problem. And then the workers as well. That's also becoming a problem. Let's know what your thoughts are. Have you visited any of the primary healthcare centers in recent times? And how was the service? What was your experience? Would like to know. Blessed Allah says, how would state move forward under the sole administrator, which is unconstitutional? The governor is really knows how to elevate the state, and he's a peace-loving man. Rivers people are contented with how he was leading. Blessed Allah says, the governor set healthcare in place before the emergency rule declaration by the president, which is unconstitutional. I'm appealing to the president to reverse that decision. Emergency rule in Rivers State has given the state setback because nothing is moving. This one says, I pray to God to help us in this state. Okay, that's from Ruth Muzan. Okay, we'll take some calls quickly. Morris is on the line from GRA. Morris, good morning.
Yes, good morning. Morris from Jared. Am I very clear?
Yes, we can hear you. Go on.
Okay. I see what your guest is complaining. Are you seeing that those that are saying that the sole administrator does not have the right to constitute any board or appoint any administrators in any parastatals? Are you now seeing that those people are the real enemies of River State? Because if you say the sole administrator does not have the right to appoint anybody, that the state should just remain standstill. The state should remain standstill till anytime the federal government broker peace. If the peace will take 2 years, 3 years, 4 years, the state will remain standstill. Are you not seeing it? Now, the sole administrator is working very hard, making sure the state move forward by appointing, constituting new boards. Now he has appointed administrators in the local government. I believe it will solve this problem. Your guest is complaining.
All right, Maurice, thank you.
They will to solve the problem.
All right, thank you. Although the argument for many people is the old boards, why were they dissolved? They should have been left there to continue working. But you were saying that the HLGAs have been functioning in that capacity, and they are the ones that paid salaries.
Exactly.
So, which means they have the backing to have run the activities with regards to as it concerns workers, at least to some
exactly.
degree?
In the absence of government runs, is that you hand over to the most senior officials of civil servant, which are the HLGs. And these HLGs, they have been running in other part of Nigeria. They have been running local government councils. So
your worry for you now is why some of them are not paying the salaries, or
why some of them are not paying, and why did they all connive and agreed not to deny primary healthcare workers their rightful salaries?
Can they also release funds for these programs to run, or for these programs to run you need the board to be instituted and the monies from the state government with regards to the programs for like immunization programs and the rest of them?
At certain levels, they can run because overhead and some other monies are given to them by the government. So when these monies are given to them, use and pay salary, pay allowances of principal officers and some other things. So they can.
All right. Leighton Barry from Bori, good morning.
Yes, good morning, Atiemie, Andrew.
Yeah.
And good morning to your guests.
All right, go on.
Yeah, I think if I'm not mistaken, I heard the guest talking about the issue of appointing head of local government or administrator to take care of local government. Maybe he's not satisfied with. And I think I asked a question a few days ago. If somebody given an appointment as caretaker for 3 months can dissolve existing appointees and appoint his own, what is actually wrong for somebody who is given an appointment for 6 months not to appoint he or she that can, support to ensure effective leadership at the local government level and other parastatals in the state? Sometimes I think the way we go about arguing issues, I think it comes to create anarchy in the state. However, the guest is complaining about his own department, the health sector, that has not been properly taken care of. And it is when they appoint people at these sectors, reports can come from various sectors to the sole administrator to know actually where and what to do at the time. So if we begin to, argue most times, this is not supposed to be, this is supposed to be, then we will always get it wrong. And that is why we continue getting it wrong. Allow the man to do his wish now that he has been given the opportunity, so that tomorrow we will not begin to blame that, this one will happen, this one will happen. Let's allow it.
All right, Leighton Barry, thank you. Point has been made. Let's move on quickly. Chima from Rimokuta. Straight to the point, please.
Good morning, Mr. Atiemie.
Good morning.
I also greet your guest at the studio.
Good morning.
Spoken so coherently. The issue is that Mr. Atiemie, some people are just allergic to good governance. Now, when we're talking about this whole thing, the man was busy maybe backing some persons that he said they are one of the bodies that actually made the last government not to work coherently. Now, people were against it. Now, this is the reason why we need a sole administration in the local government, because even the ones now that are even the same shoe with the man in your office are still undoing them. Now, the question I want to ask him there, your guest, that before now, have they written that they tried any move to see the sole administrator, because the man is open for information because of what he has come for? If they haven't, then maybe now they are putting a sole administrator in the local government now, then they should go there. But the issue is that all the persons that are trying to destabilize the government of the day, trying to see how they can destabilize, how they can make sure this administration did not work, God will not allow it to happen. My name is Chima.
All right, Chima, thank you very much. We'll see if we can take one more call before we wrap up. This one says, everything in River State is tiring. From sole administrator now to local government sole administrator. This is illegal political will, he says. We'll see if I could just take one more and then we come back to my guest to wrap up. 0817-923-0007. 0817-923-0007. You can also call 0817-923-0002. This one says, this one is from Magnus in Mile 3. Okay. Magnus, quickly,
Yes,
good
very
morning.
quickly, Andrew, good morning. Good morning,
Yeah.
Andrew. I think our primary health sector in the state, from the look of things, has been the best so far. But what we are lacking in it is equipment and lack of management. For example, the one at River State School of Health, if you go there, they have the manpower, they have everything, but we don't have facilities there. They don't have visited that facilities for several times, and I've seen what is there. In fact, some of their staff sleep on the mat, they sleep on the bare floor. So I want to appeal to the state government led by the civil administrator to, in as much as I know that he was asked to do something, he should consider the interest of the Rivers people and put in basic things that will help the people in the state. We have the flood coming. I don't think he has had time to look at these things and see where he can go to ameliorate the suffering of the people. But I think he can do more. And all we need for Rivers people to support him to do more for the people.
All right, Magnus, thank you very much. All right, a few seconds before we wrap up. Let's get your parting words in 20 seconds.
Yes, our call is that the sole administrator should intervene in these issues I've mentioned. In fact, the most important is that he should come in, make sure there are funds for program to run in primary healthcare system, and then call these HLGs to order. Let them do the right thing by paying us our rightful salary. If not, if that one is not done, we will be compelled or forced by the behaviors of these unwilling local government administrators to down to or withdraw our services.
All right, Mr. Atiemie, thank you very much. My name is Atiemie Andrew. Good morning. Hello, Port Harcourt with Jude comes on next.
The show continues after this break on Nigeria Info.